I get the sense from the questions that have been coming that there is perhaps incomplete understanding of how we go about the process of assessing what is actually wrong. The first question is the one doctor, two doctor thing. That's wrong. It's actually a team effort. We have the ultrasonographers, we have the assistants, we have the radiographer who is assessing the ultrasonographer's report, we have maybe the gynecologist, obstetrician, who is certainly very capable of looking at the ultrasound and making a determination. It's something which should be checked again. So the fact that we're saying one doctor, two doctors, doesn't reflect the actual practice. Secondly, we have to recognise that when we're coming to a decision about what to do, we're not taking into account one single factor. We're looking here at a wide variety of factors. There are personal decisions. It may be the mother's entire decision that she's happy to take to term a child which has a miserable quality of life. It's entirely in her right. And it is entirely in the right of the mother to be informed of what actually is going to happen with the child should it progress to full-term delivery. Does she want that? Is this going to be something which she cannot bear? Is it going to be such a difficult task that her life will be ruined? So to try and simplify things to a yes-no tick box resolution simply is not appropriate. And I think the debate so far indicates that there's a great lack of understanding of what actually goes on in the clinical services surrounding this very difficult situation. So just to be clear again, what we have here is a very complex decision. No single factor is going to make a determination. Even anencephaly, which were you to see an anencephalic child born, you would realise how distressing it is for all concerned, doctors, nurses, and parents. You then might make the question, perhaps this child might have a quality of life with, say, a partial anencephaly, which is true. I personally, this is background information, I went into medicine hoping to become a paediatrician. And I realised very quickly, seeing the suffering that children go through, that my heart would break. I cannot do that job. I chose not to go into paediatrics because the pain of seeing what children go through is more than I could bear. And that's just a temporary, on a ward round, walking by and seeing what can be done, walking on. I did this when I was in my training, and it was more than I could bear, and I think for most people as well. So we have to bear in mind that we're not dealing just with the diagnosis, we're dealing with the whole spectrum of issues going on just now, and trying to reduce it to a common factor which we can then legislate for is entirely inappropriate. Yesterday I mentioned that the more regulations we put into place, the more the doctors are hating it, because we need to make decisions based on the clinical conditions in consultation with the people who are directly involved, not outsiders, bystanders, not people with a moral view, whatever their moral view may be. It's entirely a decision between the caring clinicians and the grieving parents who have had to make a decision about this. It's not at all simple. It's a process which has gone through. Allowing a bit more time for people to process this. Supposing at, say, 21 weeks we have a decision to be made, and then they have this mum and dad are going to be talking about this, worrying about it, praying over it, in fact. And at 22 or 23 weeks, a decision is made, we cannot go on, because we're not going to, in that very moment, make a decision. We've discovered this, now you do this. That's not the way it happens or should happen. It's an intolerable burden placed on the parents. And so this idea of limiting the 20 weeks and specifying what can and cannot happen is entirely clinically inappropriate. Now, I'm just speaking from the point of view of a doctor here with some experience in this area. Terrible situation though it is, but those non-clinicians really have to get into that mindset of what's actually going on and not dealing with this at a distance, what would happen if, and making these points. It just is not the way that things work in medicine.